Yeah, that's right, Shauna. With schools set to reopen, the need for a simple COVID test that produces rapid, accurate results is paramount. And some of the bright minds over at McMaster University in Hamilton believe they may have the answer, that they're going to need the provincial government and public health units to get on board. You're looking at video taken inside a lab at McMaster University, where saliva-based PCR tests, also known as spit tests, were being examined this afternoon. By this evening, individuals will know if they've tested positive for COVID-19. It's proving to be a fast, accurate tool in the fight against COVID, and it's a lot easier than having a swab tickle the nether regions of your nasal cavity.
I'll spit in this tube right now if you'd like. I'll do it. I got no pride. The world needs to see just how easy it is.
Dr. Dawn Bowdish is part of the team at McMaster who are running the program, which tests hundreds of asymptomatic individuals, many from retirement communities, 3 times a week for COVID.
So this is the size of the tube that we give people. And we give people this tube because it's large enough that you can easily get your mouth over it and you can drool into it. And then we give them this bag and they put the tube in and they seal it up.
Fred, the 3, good!
The NBA have been big supporters of the saliva-based test and are said to be very happy with the ease and accuracy.
The sensitivity is greater than 95%, meaning that we don't identify people who don't have the virus. So we don't get false positive results. In the majority of infections, we found that people did not yet have symptoms. And as a consequence, we were able to pull them out of work quicker and in that way protect their workplaces and the people who they were serving.
Dr. Bowdish notes that it could also be a big win for schools. Currently, the Ontario government has received 3.5 million rapid antigen tests. 850,000 have been distributed, though those tests are different than the McMaster spit test and come with their own set of potential issues.
Those ones, if they're negative, you're usually okay. But if they're positive, it's as much as 50% about if you're actually positive or if you're not.
The tests being run at McMaster do come with their own complexities. The vial is larger than the smaller tubes used right now for nasal swabs, and public health testing sites would have to retrofit their machines to fit the larger test tubes. Now, the spit test isn't a licensed diagnostic yet, but Dr. Bowdish believes they're an early warning screening tool that could be hugely beneficial to school boards as we get set to open in-person learning across the province.
So imagine a situation instead where we have a cheap test, $7 to $10, and there's a case in a school. There's a kid or there's a teacher or the staff member, and now we test that entire school and get results back within a day. Can you imagine what a huge impact that would have on our community?
We asked Dr. Bowdish today if the spit test can help detect the variant. She believes that it can be tweaked to detect the variants, which are expected to be the dominant strain in the weeks ahead. And we also reached out to public health today and asked them about those millions of tests that the province had. They were unable to tell us whether or not they have any plan in place right now to get those rapid tests into schools when they reopen.